welcome to the 2020 Community Forum Healthcare Advocacy Across the Lifespan panel. I am very excited to introduce our four panelists today. We have Dr. Jason Edinger. Jason is a pediatric rehabilitation medicine physician in the Department of Physical Medicine and Rehabilitation at the University of Pittsburgh Medical Center and practices at UPMC Children's Hospital, Pittsburgh. He is the medical director of the Cerebral Palsy Clinic and the Acquired Brain Injury Clinic, and is passionate about helping children and young adults with cerebral palsy, brain injury, and neuromuscular disorders achieve independence and optimize their participation in society. He serves as the medical director of the Technology Assistant Children's Home Program, a program designed to serve children that require medical technology to live outside the hospital. Dr. Edinger is a co-founding member of Camp Inspire, an overnight camp specifically designed for children on ventilators. He also volunteers time to other programs, both national and international. He's the proud father of two girls, Clara, 4 years old, and Samantha, 9 months. Welcome, Jason. Thank you for being here.
Thank you very much.
And then I'm going to go down to Brenda. I'm going to go in the order that we'll be speaking today. Brenda Agnew is a parent advocate and a member of our community council. Brenda is the proud mother of two boys, Chase and McLean. Her son McLean has severe cerebral palsy and profound hearing loss as a result of a condition known as kernicterus, a brain injury that results from untreated jaundice. Professionally, she is a client liaison for a law firm, a local school board trustee, and a caregiving consultant. She tirelessly advocates for better systems and programs for children with special needs. Brenda has been appointed to the Community Council for the American Academy for Cerebral Palsy and Developmental Medicine and is an active member for volunteer organizations such as CPNet, Child Bright Citizen Engagement Committee, and the Burlington Accessibility Advisory Committee. Welcome, Brenda. Thank you. And then we have Willem Gorter. Dr. Gorter is a physical medicine and rehabilitation physician. He's a professor in the Department of Pediatrics. He is director and scientist at CanChild Center for Childhood Disability Research and holds the Scotiabank Chair in Child Health Research at McMaster University. He is visiting professor in pediatric rehabilitation in Utrecht, the Netherlands. Willem has training in pediatric and adult rehabilitation medicine, physiatry, and a special clinical and research interest in transitional services and life course health development. He is research focused on themes of family, function, friends, and family, daily activities, and participation, with special interest in physical activity promotion, fitness, and in transitions from adolescence to adulthood, future. Willem's vision is to enhance the physical health, mental health, and well-being of children and youth with disabilities and chronic health conditions and their families through interventions carefully tailored, timed, and integrated into health services. He leads a research program that advances the knowledge of health development of people with disabilities and that enhances research capacity, peer mentoring, and training. Willem's research is frequently published in peer-reviewed articles and in leading journals. Welcome, Willem. Thank you so much for being here. And then, of course, we have Alexis Nichols. She's a self-advocate and a community council member. Alexis is a motivational speaker and an advocate for people with disabilities. Born with cerebral palsy and acquiring many other medical complexities, she has much experience navigating the disability and medical field. She sits on various boards and councils representing people with disabilities and continually shares her message that you define your disability. Your disability doesn't define you. Cerebral palsy has been one of her biggest blessings in life, and she is thankful to be able to share her experience with you. Thank you, Alexis, and we are so thankful for you to be able to share your experience with us. All right, I am going to turn it over to Jason now and turn my camera off.
All right. Here we go. Well, thank you for that kind introduction. I'm really excited to talk to you guys about healthcare across the lifespan today, or healthcare advocacy across the lifespan, and provide physicians and providers' perspective. Oh, sorry about that. I have no financial or disclosures or conflicts of interest. And so I want to look at really what is advocacy. Advocacy is defined as public support for or recommendation of a particular cause or policy. Now, that doesn't really get at what I think of when I think of advocacy, so I would like to expand that a little bit further and kind of break that down into self-advocacy, where someone is able to effectively communicate their own wants, needs, and desires and rights. Individual advocacy, when a person or group of people will concentrate their efforts on advocacy to one or two individuals, making sure that they have their interests, desires, needs, and rights met. I think those two are really important. When we talk about advocacy, we don't want to just talk about getting legislation passes or changing society. Those are important, but also making sure that those changes that have been made, those battles that have been won previously, are applied to individual people. And unfortunately, there can be a lot of barriers to making that happen. And then finally, it's systemic advocacy, where we try to make those bigger picture changes, those policies and societal changes. And that can be at a local, state, or national level. And advocacy can occur in a number of different areas. It can occur in the school, in the workplace, at medical centers, with insurance companies, within the community with regards to legislation, and through research and quality improvement projects. And so, from a provider's perspective, we have kind of an opportunity to listen to those that we serve and the barriers that they encounter. We try to involve them at any level we have access to, but with regards to persons with disabilities and families and caregivers of those people with disabilities, to provide support wherever we can. When we're not able to involve someone, we can do our best to represent, and then to educate other providers, but also educate families and persons with disabilities on how to advocate going forward. And from a provider's perspective, there are, I think a lot of us have passion to make great changes in helping people, but there are also some limitations on our end in terms of are recognizing what we can affect. So, one thing in looking at what our scope of influence is. For example, we can make recommendations about an appropriate accommodation in school, but the school is not required to take that recommendation and put it immediately into an IEP or another education program. They often will, but they're not required to. So, again, working with some of our communication skills, educating and negotiating, we can try to help with that. We also, unfortunately, have many competing demands. Though I think we're all, again, I like to think about the positive in people. We have our clinical patients we have to see. We have other administrative responsibilities, and we need to maintain a work-life balance as well, and make time for that, and also prioritize advocacy as a part of that. And different providers will have different experience with advocacy. I think, like anything in life, the more we participate, the more we learn, the better that we can navigate advocacy. But it's not necessarily something that's taught very well or via a curriculum in our training. But I think there are opportunities if there are mentors, either at any level of training or our profession. If you have that access to a mentor, it can make a big difference. And then finally, developing our communication skills and how we negotiate with, how do we handle conflict. Hopefully we can handle that well, and educate others to do so as well. So in terms of listening, we want to try to identify what are the barriers that are important to people with disabilities. We can conceptualize it, but as a provider, but if we don't take the time to listen and give someone an opportunity to explain what is the challenge with a certain activity, I always find it's the second or third level question that it helps me understand what's going on. And if we can do that, then we can more effectively communicate with others and make changes. And it's really important to, of course, keep in mind different cultural or language barriers. What's important to one culture may be interpreted very differently, may not be important as important. And, with languages, the same concept can be misunderstood depending on how it's being communicated. It's very important that we involve patients and family in advocacy. I like the mantra, nothing about us without us, which kind of speaks to that when we're talking about enacting policies or laws, that we should be engaging with the people that law and the policy affects. So as a physician, we can recommend that people with disabilities are represented on advisory boards, like for example, within a hospital. We can try to encourage our hospitals to design satisfaction surveys that will communicate the problems or barriers. So for example, if though I would hope that all our facilities where I work are accessible, I don't necessarily know every part of it. If we're lacking a bed that automatically raises or lowers, or that there is a doorway or that is not wide enough to get a power wheelchair through, or a bathroom that's not wide enough to turn. If we create surveys in a way that those concerns can be addressed, then we can get valuable information to hopefully make change. We can also providers can also design quality improvement projects to engage with families and people with disabilities to make sure that we're meeting their needs. And then we can encourage and help people to self-advocate for themselves and use our experience to help others. And that can be something as looking at what their insurance policy covers, advising them to read and look into that, and that can help navigate what their rights and access to with regards to insurance or other issues. And we can also connect people and caregivers with patient and family advocacy groups, and then to support those advocacy groups wherever we can. In terms of support, we can look at supporting individual people with support services, such as linking them up with social work, a medical home, or case management, and then in turn supporting those services, encouraging hospital administration to prioritize some of those services that may not be generating income, but are still really critical. And we have good evidence to show that that's the case. Physicians can also serve on community and hospital advisory boards to represent patient and family concerns. And again, and I have found, at least in my area, when moving to a new area, it takes time to learn what resources are out there. Insurance varies widely in terms of what is covered from state to state. What nonprofit organizations are there to help. So for example, in the state of Pennsylvania, it's relatively easy to get most items in a power wheelchair covered or a standard wheelchair covered, but they won't pay for a ramp or any other changes to the home. So trying to be aware of what other resources can help with those things that insurance doesn't cover, and getting to know your region. And again, I work in Western Pennsylvania, which our hospital covers Ohio, parts of Ohio and West Virginia. And the resources that are covered between Pennsylvania, Ohio, and West Virginia are unfortunately vastly different. Other ways that physicians can support patients and families and people with disabilities are to help educate insurers. We participate in peer-to-peer processes, which we can be very successful if we can communicate why a given piece of equipment, I'll use DME, for example, that's what I work with most of the time, why a given piece of equipment is necessary, kind of communicating why it's often helpful to try other devices and why those individual devices don't work. And that's really a shared communication between the person with disability, the person in need of the equipment, the provider, and also other providers like therapists to help come up with that language and communication. But it's also important to even, there are many times where if a given piece of equipment is not covered by insurance, we're not going to make progress with peer-to-peer. But there are times when the peer-to-peer is denied, and then you can go on to other steps of appeal. And I think it's really, I encourage people to, if you're given the opportunity, be present for those appeals. It's very hard for someone to deny a given device, one, in person. It's much easier to deny it over the phone. But also, if they can see why someone might need an elevator to be able to live on their power wheelchair, to be independent, to be able to access their counter in their kitchen or the cupboards, or to be able to maneuver in their bathroom, that can be very powerful. And I think if you can get people to see the issue, you have a much better chance of success. And then I think also providers have a role in helping people advocate for different options. And this is kind of advocating for on the individual level. But for example, we live in an age where social media and the internet allow information to spread at the speed of light. And sometimes that's great information. Sometimes, it's information that doesn't have a lot of information, or that doesn't have a lot of research behind it, or that could actually be harmful. I think a good example of that is, I think of as hyperbaric oxygen, which has some great indications, but it really doesn't have much benefit or much evidence of benefit in people with cerebral palsy. On the other hand, it can do some harm. It can cause a need for ear surgeries, and it is quite expensive, and insurance doesn't cover it. So if you're working with trying to help someone determine where is the best way to use your resources, a course of treatment with hyperbaric oxygen, for example, costs about the same as a wheelchair accessible van. And if someone is going to need that at some point, you can really help to try to steer someone in one direction versus another. For some people, they won't have to make a choice between those two things. I think most people are not that fortunate, and hopefully we can be helpful in that way. Then looking at a broader level, we can represent through professional organizations and working with research. There's the CP Collaborative, which is a network of organizations representing individuals with cerebral palsy, their families, providers, and researchers that often have shared goals. And we can use strength in numbers to advance our platform. And that's really where you can start making society level changes. And the same thing is true with research. The AACPDM, which I'm fortunate to be a member of, has, and working with the Advocacy Committee, and the Community Council, research can sometimes move the needle if you can demonstrate with numbers that something makes a difference. Sometimes that will make the difference in whether a law will get passed or fail. And then it's important to educate others in the importance of advocacy, and that can be educating other providers like medical students, residents, fellows, or people or other providers who are finished their training but are interested in learning more. Educating parents and caregivers, and most importantly, young adults. And so I think negotiation is a really important part of any advocacy, because you will have different stakeholders, different people involved in the process who will have different goals, and trying to know how to navigate those can be really important. Because you want to identify the needs of everyone involved. And so you can try to identify someone who can be your partner, so if they have a shared goal as you. If they're not aware of the problem, we need to educate them. So hopefully we can get them on board. If someone who's unsupportive, well, you go take some extra steps to convince them, and see if you can get them on the same page. And then if someone is opposed to you, well, maybe it's not the right time. Oftentimes, if you can wait till another day and find another way to work together. And I think, often whether you're working with legislators, or you're working with, an IEP meeting at school, you want to try to avoid drawing a line in the sand, and end every negotiation or process in a positive way. Even if you don't get your outcome that you're looking for, it's a good chance you're going to need to work with the same group of people again, and you don't want to burn bridges with them. You want to have everybody come away with a positive experience if you can. And consensus is not building consensus to make change is not always a win or lose. Sometimes the best outcomes are a compromise. And unfortunately, we have to. It's not a process that, particularly in terms of societal change, that we're going to get it right the first time. So we have to be patient, keep plugging away, keep trying, and unfortunately accept failure from now and then. Expect failure now and then. Learn from it and come back and try again. And slowly, hopefully, we can make societal change. So I think our biggest resources in making change are working together, using shared goals and shared resources, and then again, using evidence to justify those changes that we're asking for. And I think it's certainly a challenging process, but one that's worth it. And then I've just listed some resources here that may be helpful for you, depending on what type of advocacy you're looking at or where you're looking at engaging. For every state, there will be an Office of Vocational Rehabilitation. Sometimes it's called something different. I've listed the OVR in Pennsylvania as a resource. That's my local organization. In terms of looking at school, understanding what your rights are through the Americans with Disability Act and the IDEA can be really helpful. I've provided a link there to the Department of Education, and they have some nice frequently asked questions there. I think it's a great idea to read your insurance policy, know when you're asking for a given thing, a given item or treatment, understanding what's covered or what's not covered. And I've also listed a couple websites that are kind of how-to guides for advocacy, and how to build an advocacy organization, how to and how to engage and advocate. It's not specific to a given policy. And then the last item I have there is a resource to find your elected officials. So that's for your state, local, and federal government. I think if we run into a barrier that you can't overcome through individual or self-advocacy, it's really important to engage with your representatives. Again, I always try to look at it with the glass is half full. I think people, if you can engage with them, meet them, become a story, become a personal interaction, they're more likely to support you than if you are a number on a piece of paper. So when let's say legislation comes up for funding a given policy, if they understand that it's important to their constituents, they're more likely to remember that and hopefully vote in the way that you want. Well, thanks so much for your time, and I hope this was helpful.
Okay. All right, so I guess I'm up now. So hi, everybody. I hope that you can hear me okay and you can see my screen. I wanted to talk a little bit about advocacy from the parent role. And so today we're hearing from physicians and some different perspectives that they have. We'll be hearing from somebody who's living with cerebral palsy and from their perspective. But I wanted to talk a little bit about advocacy from the parent role. And, I want to preface it by saying that, I feel like of all the challenges and of all the pieces that come with parenting a child with cerebral palsy, and that can be any special need, but that advocacy has to be probably the most complex, emotional, sometimes physically draining piece, because it is all the time and it is everywhere. And as the parents who are probably listening to this can attest, this can take a role from anything from advocating at your school, advocating for more resources, for more funding sources, for equipment. So, it feels like on any given day, we're constantly in some sort of advocacy mode. And so it really does become all encompassing. And this was not something that I had anticipated that would be such a huge part of parenting a child with a disability, would be this advocacy piece. And so it's really interesting when I took a look at advocacy across the lifespan, and really sort of took a look at, what did that look like? And I'll talk a little bit more about that lens and how that changes. But, it's really interesting to look at what parental advocacy looks like. What is your role? When kids are younger, obviously you are their guardian, you are, you're their voice. And so a lot of the things that you need to take on from advocacy perspective become your battle, if you will. And I hate using that term because I think advocacy can be such a positive experience. It doesn't always have to be negative, but usually battle or fight is the image that we'll often associate with advocacy. But it's really important to sort of understand what your role is, and that role will evolve over the time of your child's life. And again, so you start off and when your child is younger, you are their advocate, you are their voice, you are the one that is, whether it is trying to get referrals, trying to get, things going at school, again, trying to get something you may need from your home. It could be a conversation with an insurance company. It could be funding sources. It could be all of those things. And, as your child grows and as your relationships change, it's interesting to see, how that role will evolve. And so the role, for many, the guardian piece will still remain. And I know that we may address that later on with one of our other speakers, but that guardian role may remain, like I said, depending on the functionality of your child and depending on their ability to make their own decisions and be their own advocate. But there's so much involved in that. There's the role of the friend and the support person as they go through, as they start to want to advocate for their own things, and as they start to decide what it is that they want or challenges that they come into. You're a parent, so it's you monitoring what it is that they want to advocate for. If they're trying to advocate for something that, just isn't going to fly, is, stepping as a parent and not wanting to quash what it is that they want to advocate for, but still needing to step in from that parent perspective. I'll talk a little bit more about some of the things that I think are helpful to keep in mind as you look at advocating through the lifespan, but, being a resource for your child and being a team member. And, when I speak about that is, providing them as they're learning these advocacy skills to pass on to them the things that you have learned and the information that you have gathered. Because, at some point we need to prep them to be able to advocate for themselves. And, as Dr. Edinger had commented as well, this could also involve a larger team. This could also involve other family members or other close family friends who may need to become involved in those advocacy efforts, perhaps when we're not around anymore and they've identified someone else who's going to help them. So, I look at, I talked a little bit about, what does advocacy look like now? And then what is it going to look like? So advocacy now, and it changes. It really does change. It changes depending on the position in life that you are with your child. It depends on what's happening at that time. I looked at when my son was younger, a lot of our advocacy was around healthcare advocacy. It was advocating, again, for referrals. It was trying to get diagnoses. It was trying to get therapy interventions. It was trying to do things like that. And that's really what it looked like. And, and that what I say would accompany sort of the first couple of years is you're so all entrenched in a lot of those things. And then it moves a little bit. And then it might become, all of a sudden now you're recognizing that you need to have some additional supports and resources, some additional funding sources. And those, as much as we think they should come readily, they don't always come readily. And so, we find ourselves in a situation where we may have to write some letters and make some phone calls to try to get some things done. And I've used an example of simple things, even, sometimes even our local park, having to advocate for a special needs swing so that we can go and enjoy the park like everybody else. And those aren't things you typically think about when you think about advocacy, but those are the types of things that become important at that stage of your life with your child. And then, it evolves, and then you get into school and you're starting to advocate for things that they need in the school system. And that obviously, takes them through a number of years. And so you're advocating on the earlier years, and you're looking at how to advocate as you get into high school, because it's a whole different ballgame. And during all of that time, you're still doing all of your other advocacy. You're still looking for funding. You're still looking for equipment resources. You're still looking for all of those things. And perhaps somewhere along the way, you've tried to, participate in research studies, or you've tried to do some other things. And weaved in and out of that still comes the healthcare piece. So while it may not have been all encompassing, beyond that first 2 years, you might find yourself back in a situation where your child is presenting with some other challenges or some other conditions that all of a sudden you're looking now again for some new diagnoses or some new referrals or some new interventions. And so, the lens really changes depending on where you are again at that stage with your child in that journey. And then I think a lot, my son is going to be 13. He's just a little bit younger than Jen's son. So, we chat about things like this, here and there, but, the advocacy, what is that looking like as he gets older? He, definitely, with my son and with a lot of children like him, we are always going to have to play a significant role in assisting him with advocacy from a functional perspective, a hands-on perspective. But he's starting to really know what he wants, and he's starting to understand some inequalities or some things that he's seeing that he'd like to have that are not coming as readily available. And so trying to understand and figure out, what is that going to look like? At what point do I need to start having more of a fingers out, nose in approach? And when do I need to be all hands on deck? And how do I slowly make that transition as I try to prepare him to become his own advocate and do his, and be his own voice? And then how do I help him do that? And again, like everything in parenting is trying to balance, that tendency to jump in and advocate for him or be his voice when, he maybe wants to be his own voice. And I would see this happen a lot, even over the last little while at school. I would be so adamant about something that I wasn't happy about and that I really wanted to change. And then, someone would say, well, what does McLean think? And, it's a realization moment to be like, well, I don't know. I haven't asked him. I haven't checked with him. And then all of a sudden, I check with him, and his lens is very different than my lens. And he doesn't feel the need to fight for what I automatically wanted to charge up the hill to argue about. And so, that's been really interesting. And again, that's a place that I find myself as we move through this span, is that I feel like that, and I see that advocacy role really, really changing a lot. And even from, Dr. Edinger talked about getting involved with research studies and getting involved with, family forums and getting involved with patient and family advocacy committees. I've always done that. It's something that I really enjoy, and it's something I like being a part of. I like to be able to invoke change on a number of different levels, whether it's really, really small, or whether it's something more significant, which is also a great thing. But now I'm starting to involve him in some of those, and him,
No, not yet. Where's Dad yet?
bringing him into some of those processes. And so I'm looking now at more opportunities on some of these research committees when they're looking for youth and they're looking for young adults, to talk about their experiences and to talk about things that they want to see. And maybe that's shaping research priorities. Maybe that's taking a look at processes or guidelines. And so starting to loop him into that and really start to involve his voice, because I do need to start prepping him for that. And so I wanted to share, what I felt were some of the steps for advocacy as a parent that I've come to, narrow down over 13 years. And I have done my fair share of advocacy. I'd love to say that things have come easily, but unfortunately that they haven't. And, there's been wins and there's been losses and there's been positive experiences. There's been negative experiences. And I think that that's true for anyone who advocates in any capacity. I feel for us, it's a little bit more emotional, again, because it's our children that are involved. So, it is a little bit more sometimes emotional than, maybe advocating for, a building not to be torn down in your area or, something like that. This is definitely something more that hits home. So these are some of the things I've spoken about to other groups over the years, as far as some of, narrowing down really some of the key things to keep in mind as we advocate through the lifespan, and as we are preparing our children to start advocating or helping those people who will be in their care circle as they move forward. And so some of the things, because again, you could really get caught up in advocating. Again, it's passionate, it's emotional, it's obviously something that you truly believe that you need to have. And sometimes, like I said, it comes easy. It's an easy ask. And you're pleasantly surprised when you're granted your request. Sometimes it's letter writing. Sometimes it's involving a few different people, and sometimes it becomes more complex. But what I always try to say to people, so that you don't get really swept up in everything, because you simply cannot take on every battle that comes your way, is how do you identify the key issues? What is it really at the heart of what it is that you are trying to advocate for? And try not to complicate that. So, if I use the example of that, that accessible swing in our local playground, that's what I want. I want the accessible swing. I want the swing so that, when he was younger, I could put him in the swing. We could go to the park together. He could participate. And I believe that opened up inclusive opportunities for everybody in our neighborhood. And, they got to see McLean and he got to see them. If you start to turn that into, I want to change this entire park and I want to change all the parks, and then not just in my city, but I'm going to change them in every city, that becomes overwhelming. It may be something that you work towards, but, you've only got so much energy. We have to remember at the end of the day that we're parenting children with disabilities who have a lot of needs, and that's overwhelming on its own. And, you add in this advocacy piece on top of, not a lot of sleep sometimes and not a lot of support, and it does become overwhelming. So identify those key issues. It helps you to really narrow down to what you're looking at. And then, really identify what it is that you need to know. What is the information you need to know about that? So again, if I'm looking at, the accessible swing, I might want to find out, are they available? Are they easy to get? How much do they cost? Maybe what other parks have them? Having that information at your fingertips, is going to be helpful for you as you're moving this message forward. And then you need to craft your message. And this is really important because a lot can get lost in translation. And if you have identified your issue and you know what it is you're talking about, but you're approaching this from a very different angle, and your messaging is not clear because maybe you're angry, maybe you're upset, which is okay, but maybe you've convoluted that message and it's not coming across as clearly. So if you go in and you're advocating for this swing and suddenly you barge in and you're talking about all the things that are wrong with the neighborhood, your message is going to get lost. So if you craft the message to be like, I need a swing, I would like a swing, and this is why, it's a lot easier to stay on that point and to keep that message clear. And I just find it to be helpful. And then who's on your side? So again, Dr. Edinger had commented about, what resources do you have? He spoke about it from a healthcare perspective. who do you have on your side as you're advocating some of those healthcare matters? And I know I'm using the example of a swing, and that might seem so small compared to advocating for a therapeutic intervention or surgery or something like that. But at the end of the day, the steps are all the same as far as what I have experienced. And so, find out who is on side. Who are your helpers? Are they people that you're friends with? Are they people within the organization or the association that you're trying to advocate to? Do you have people that have been through this before? So again, using the same example, I had friends of mine who popped up and all of a sudden, they started tweeting things and they started doing some research for me, or suddenly they knew someone in the recreation department. Those just make things a little bit easier, and that can be applied for anything: healthcare environment, the education system. Is if you can find out who's on side and if you can find a helper, that will just make your life so much easier. And I have found that from a healthcare perspective. My son, was needing to get a surgery. It was a complicated surgery, and I reached out to every single ortho surgeon that I had access to get their opinion, to get their insight, so that we could make our decision and advocate for what was best for him. And then, what is your ultimate end goal? So that could be different than your key issue, and that could be different than your messaging. What is your ultimate end goal? So, your key issue might be that they don't have an accessible swing in the park. Your end goal is to get that swing. And so, identify what that ultimate end goal is, and be flexible on that, because maybe what you're asking for can't be done, which is unfortunate, but that is the reality. There's things that we advocate for that we desperately need and we should have, and our children should have, but they're just not going to happen. And that's sometimes the fault of no one, and they're beyond our control. But what is your ultimate end goal in all of this? And if you keep focused on that, and maybe even have a little bit of variability with that end goal could be a little bit different, depending. I think it again allows you to stay focused. And then the last two pieces are really important. And this is where I find that a lot of parents will come to me or come to other people and be really confused. They know all the rest of this. They're good research people. They've identified what the need is. They've crafted their message. They've done everything. And then they don't know really what to do with it from there. And I think it's really important that we as parents understand that our voice matters. It matters very much so. Again, the voice of people who are living with a disability, their voice matters. Our children's voice matters. They all matter. And participating in those advocacy groups, in those engagement groups, participating in research studies, all of those things, it is vitally important that our voice be there. And I don't want people to ever feel, no matter what point you're at in this span, that your voice doesn't matter. It always matters. And I think that can become very overwhelming for some people. And I think sometimes they minimize the importance of their participation. And, I try to remind people that whether you're advocating for yourself, whether you're advocating for a group of people, whether you're advocating, on a national level, your voice is really, really important, and it should never be minimized. And that's something we're really trying to teach, my son, is, your voice is important, and you need to speak up, and you need to say something. And if you can't get that across, find someone who can help you do that. Because, once you lose your voice, it's really hard to get all the rest of this done, no matter how much work you've done on it. And then the final point that I'll leave you with is just confidence. Confidence is key. And start early. Whether you're the parent that's advocating, listen, you're going to have a long go, right? This is lifespan we're talking about. This could be 70 years or, well, that's a lot. I hope I live that long. But, this could be a lot of years of advocating. And for your child, this is a lifetime of advocating for them. And, you need to be confident. And that doesn't have to say that you are the most outgoing, most, talkative, most, extroverted person that but having confidence. Listen, this is important to you. This is important to you. It's important to your child. It's important to your family. If it's important, then the confidence needs to be there. Don't let anyone minimize that or trivialize that piece. Confidence is key, and we need to start that early. We need to understand that we are important, and our advocacy matters, and what we're asking for matters, and that we have every right to ask the questions we're asking and to ask for the things that we're asking for. And these are things we try to teach McLean. We've started that early, and we're really trying to enforce that with him. I want him to be confident when he asks for something. I want him to be confident when he receives a yes or no answer and how he's going to deal with that. But I really want him, because I think if you can't have that competency piece and you don't feel confident stepping into that situation, it's going to be really, really hard to do the rest of this. And that confidence, you might need a boaster of that, but go to a good friend, go to someone who knows you, go to someone who can help you. We all need help from time to time, but you can do it. And we've seen some powerful things come out of advocacy, especially in this world that we're in. So that's it. So thank you for listening.
So we'll continue, and we heard a lot about advocacy across the lifespan, and I want to reflect a little bit in my presentation on that notion of lifespan or life course, taking a life course approach, and just start with the understanding that, children with disabilities grow up, become teenagers, become adults, and that can come with challenges that come for challenges for anyone. So I always like this saying of growing up is hard to do, but for some, it's even harder than for others. And that's what I want to talk about and look with you and discuss how advocacy can play a role. I have been introduced already. Thank you for the nice introduction. And one of the things that I try to do in terms of advocacy is to raise awareness about that notion of children growing up, becoming adults, and transition out of the pediatric healthcare system into the adult world, adult healthcare system, and also in the community. And social media is one way of helping raise awareness, also not only in the medical community, but also in the general public. If you are interested, I have here a link to a video that was recorded with one of the families that I've worked with, and it learned me how important it is, that notion of leaving a relationship that you have maybe worked with for many times and years in the children's hospital, the pediatric healthcare setting, and then being on your own, and what the anxieties that comes with it. So, looking at our field and also the American Academy for Cerebral, Palsy and Developmental Medicine is highly focused on young children with a disability. It really is driven by developmental medicine and developmental pediatrics and rehabilitation, pediatric rehabilitation. And then suddenly these children these children often are well supported as much as we can, and still there's a lot of room for advocacy and for improvement, and also in many places in the world. So that part I want to sort of jump right into the next slide, which is, okay, what are the things then that are important? And the medical field and in rehabilitation, we like to use a framework. It's called the International Classification of Functioning, that was developed by the WHO, the World Health Organization. That is sometimes hard to remember. And we found that a couple of themes are very important to individuals with disabilities and families. They are family, function, fitness, friends, fun, and future. And all these efforts fit in the ICF framework, except for future. Future is forgotten, which is, I think, the most obvious thing if you talk about children growing up and becoming adults. Future is actually one of my favorite F words we should pay more attention to. So what do we actually know about children growing up and becoming adolescents? For sure, we heard already that children becoming more their own voice, have their own opinions and ideas about their lives, and may not be necessarily the same lens as a parent may have. The other thing I want to highlight is that the awareness of children growing up and becoming adults has changed too, especially over the last 30, 40 years. It's not new, but the life expectancy has changed so much for the better that most children with neurological and developmental conditions do survive into adulthood. In fact, there are more adults than children with child-onset disabilities. We now start learning also through our research and from young people with the lived experience. We did a qualitative study, and this is an open access article, so you can find it on internet and can download it for free. And what is important is that although cerebral palsy or another disability often is defined by some medical conditions, and for cerebral palsy, the difficulty with movement and posture. If you ask young people what's going on in their lives, it's much more than that stereotype of having difficulty of walking, for example, or getting around in a wheelchair. It is about living a life. It's about going to school, or maybe post-secondary education, or getting a job, starting a relationship. The other thing is that I learned from this study is that there are so many things that are invisible. And that's, the advocacy is really around making the invisible visible. On our end, as healthcare providers, I think we should ask about those invisible things. How are you doing? What's going on in your life? What is important to you? And how can we help? And on the other hand, also, through asking those questions, providing the opportunity for young people to learn how to speak up and to express themselves. I don't want to go into all the details, but I do think it's important to share some of the high-level outcomes that we start to learn about through our research. It's still in its infancy, but overall the picture is getting more clear that the adult health outcomes are not good, and they can be much better. And so that's where advocacy comes in. I think we need to work towards a more equal opportunity for people, young people with disabilities. Sometimes there are the specific healthcare issues related to the body. For example, physical fitness, pain, and fatigue are often reported. But we also have to think about mental health issues or symptoms as anxiety and depression are more frequent. Some studies report 2 times more often than in peers without a disability. And then there are the participation outcomes. Living on your own, for example. More often, youth with disabilities continue to live with their parents. There are lower rates of employment, and they have fewer relationships and intimate relationships. So these are outcomes that are not acceptable, and I think we need to work on together. Beyond becoming an adult, there is the whole process of adulthood, which is also comes with phases and aging. It's important to recognize that in addition to normal aging, as for anyone who gets older, is also an aspect that sometimes aging process can start earlier in people with disabilities. So we need to be cognizant of that. And again, healthcare providers, but also people with disabilities and the families need to be aware that sometimes this needs to be checked earlier than later. And then there is the notion of what we call multi-morbidity. So physical health issues sometimes go together with other diseases and a higher risk, including, let's say, if you have lower level fitness levels, that could increase not only fatigue and pain, or can be associated with that, but can also be associated with cancer and conditions like diabetes. The other multimorbidity is the going together of physical health and mental health. This all together asks for what I would call a life course health development approach. So children with childhood onset conditions are living a life, as we all do, from childhood into adolescence to adulthood and becoming an older adult. This is a conceptual framework, but it puts things in perspective. And if you think of advocacy, everything we do in helping children and advocating for supports and resources for children can have a positive effect in the long term. It will set children up for a better future. And of course, also for the families, it's important that everything you do early on can make a difference in the long term. Some things are in your control, as we heard earlier. Some are beyond your control, or at least you can advocate and try to influence. A special moment in time is the divide between often the services that are provided to children and adolescents, and then in the adult healthcare system and in the community. That can be very can be a divide which can be very hard to cross. And although many people start becoming more aware of it, still it is a change that should be recognized. There are good things about it because you advocate for children becoming adults. Nobody stays in high school forever. So you will leave the pediatric healthcare setting. But at the same time, it takes a lot of energy to develop new relationships in the adult healthcare system and to navigate adult healthcare system. So transitions in general can be challenging, but in particular from pediatric to adult services. And we are talking now at a virtual meeting and wireless age, but there are some improvements, but it's still difficult. And many children and families feel alone. And I think it's important to recognize that. Over the last 10 years, I've spent quite a bit of time thinking about what are the different levels where we can act also as healthcare provider. For example, I started a transition clinic at the McMaster Children's Hospital. And at that level, you can provide services for children and families, help for transition. There's also some opportunities in the province of Ontario and later at the national level to develop guidelines to help improve transition outcomes. And I think they are valuable, but they don't necessarily change practice. I think for advocacy, there's a true opportunity to target the institutional and hospital level, as one can potentially also as a family, but also as healthcare providers together, influence local policies and also to make the connections with the people who can make the difference. I'll show you an example where we work to a hospital-wide transition approach. So this is not only for youth with disabilities, because children and youth with other chronic health conditions also are facing the same challenges in their own world. And I think, as I said, growing up can be challenging for anyone, but for some it's harder. And for those who are and are in need for continuity of care, we want to have an approach across the hospital. One of the things that we have developed was an app that basically is a springboard for the conversation around transition. So when you are a teenager, to become more aware, okay, where are you now and where are you going? How do you see your future? This transition app can be downloaded from the Google and Android and platforms. One aspect of it is also paper version is the transition queue questionnaire. It asks 14 questions. From the first question, for example, I answer a doctor's or nurse questions and can be answered never, sometimes, and always, to more difficult items, for example, booking your own appointment or traveling to the doctor on your own. We heard earlier that it's important when your son or daughter becomes a teenager to have them express their voice. What I've learned in my transition clinic is that we can talk about transition, but it only becomes real, especially for teenagers, when you practice and you assess actually where the skills and the knowledge level of children with disabilities are. I think in general, healthcare providers, and we also have some data supporting that, overestimate the level of self-management skills. And we don't provide enough opportunities to practice those skills. It's not only the skill, but it's also learning how to advocate and to speak up for yourself in a healthcare setting and beyond. And that's also practicing in the, for example, My Health 3-sentence summary, where youth can practice in saying what the diagnosis is, the health information, and what their needs are, and what they would like to talk about during a visit. So for today, I have a couple of take-home messages. I think it's very important to shift towards adolescents' capacity to self-manage as much as they can, and to the things, education and empowering both the youth and the families to support healthcare transition. And that should start early, so you have actual time to work together and practice before children and families leave the pediatric healthcare system. I also learned that assessment, and based on that assessment, setting goals are very effective, because you then can do a timed and tailored intervention to foster skills and knowledge. And that makes it meaningful for them. I must say, as much as we work with the youth with disabilities, families are always an essential part of this transition process. And parents are the safety net. So you will continue to advocate for your child. And then there is the need to build capacity in adult healthcare. There are still too many healthcare providers in the adult setting that do not know enough about people with disabilities, what has happened when they were a child, and what their needs are when they are an adult. So we need to take a life course approach beyond healthcare. It's also in the community. A couple of things that the American Academy is doing. The American Academy for Cerebral Palsy and Developmental Medicine has a lifespan committee with members that are very active in promoting this life course approach. And since last year, we also have a special interest group in adults and aging. It has just started and is basically a community together around topics of interest, around research, education, but also as a community of people with lived experience, and bringing together professionals as well as both people with lived experience and families. Thank you for your attention.
Hello, everyone.
Alex.
Yeah, it took a second. Hi. So I just have to say, first off, listening to all my fellow presenters, I loved everything that everyone has said. And I wish my camera could have been on the whole time, because I was sitting here smiling and just oh my goodness, everything that was presented has been great and is very, very true. I could start from working backwards, but I will give you guys a little bit of information about me. So I have cerebral palsy, obviously, as most people at this conference probably do and or are caregivers for. I'm 23 and I have been given an amazing life because of what I have. And I'm so thankful to be able to be here with you guys and share information with you. I decided to do things a little bit differently than my other presenters. I do not have a slideshow. I wanted you guys to see me and hear my story. And so we may put in some photos either before or after my presentation just to give you guys a little bit of context, something to see, or not. We'll see. Don't know how it's going to go. But I will start off by saying, as a child, well, speaking of my CP over the course of the lifetime, I'll start from when I was a kid and then work my way up because that's the best way. And so as I said, I have cerebral palsy, spastic triplegia. I'm a wheelchair and a walker user. And I have always been a very, very, very strong advocate for myself. Started walking with my walker at age 2, and it was then that I started to change people's perceptions of people with disabilities. Because how often do you see a 2-foot tall child with brown hair and a bright blue frame around her? You know, y'all got the image in your head now. And, you know, people don't see that. So just by having people look at me, I started to change their perceptions. I started to show them with a smile on my face that disability didn't have to be a bad thing. You know, I've never looked at it as a bad thing, and people may differ on how they experience that or what their feelings are towards that. But for me, I've always embraced the walker. I love it when people ask questions about my walker because it's the way of getting to know me. Now, my walker is zebra. Yeah, I walk around with a zebra painted walker with also pink on it. And, you know, so it really is a huge conversation piece. And then, so moving on a little bit past the age of 2, I did early intervention and everything like that. Then I went to school. I was at regular classes for the most part, got pulled out for some learning disabilities and things all throughout school, except for high school. And then, yeah, so with that, I told my mom at a very young age that she didn't know what it was like to have CP. She's a great mom, but she didn't know what it was like to have CP. And that I was going to be the one to make my medical decisions for me because she doesn't live in my body. So luckily she was very, very grateful and respectful, or I'm very grateful that she was very respectful of that opinion, and she was there for me as a source of guidance or resource for me, but she definitely let me make my own decisions. And with that, I have to say, start your kids early. And I do want to say, I'm speaking to the parents, the caregivers, as well as the people with CP on this call. So kids, teenagers, young adults, listen up, come in the room because you need to hear this too. And so teach your kids early. Kids with disabilities, people with disabilities, learn how to advocate for yourself early on. Learn about your disability. Learn more than just what the doctors tell you. The information that they have is great. However, sometimes they will only tell you what they want you to know. So link up with other people in the disability community, link up with people outside of the disability community, and learn as much as you can. And when I say link up with people with and without disabilities, make sure that you're not just in your own disability community. A lot of times people don't want to expand. They want to stay safe in the disability community because you've got people that understand you. And while that's great, you need to have a vast community and a vast resource of people around you. Even if it's so much so, you might be the only disabled person that somebody sees. You know, you have the ability to influence and change and make a difference on people's perceptions as well. It wasn't just me that did this. You know, you're capable of doing that as well. And so that's something that you really, really need to keep in mind. I have a few notes here that I'm going to keep looking at just to make sure I keep myself on track here. And then, so yeah. Also, going back to the parents advocating and the children advocating and things, know that every person has the ability to make choices, has the ability to advocate and communicate in a different way. You know, we may not all advocate the same way, we may not communicate in the same way, but every person has the ability to make a choice and has a voice that they can use. Sometimes I hear, you know, parents will say, well, I don't want my kid to, or I can't let my kid talk to the doctor that much. They're not going to be able to handle this. They're not going to understand what the doctor's saying. They're not going to be able to make that appointment. And they're not, you know, and my response to that would be, they might not do it in the way that you think they should, but that doesn't mean that they can't do it. And the world needs to see your child. They need to see you. That again goes back to going out into the world. I go out into the world unashamed of who I am, with the intention to let the world know that disability is not a bad thing. You know, I go out into the world unashamed of who I am, knowing that people will see me, and again, their perceptions will be changed. And I think that's an amazing way to look at it. I think we've all been given amazing gifts in life, and to know them and to be able to embrace them and to continue to use them is just an amazing opportunity. Let me go more down my notes here. Also, you know, make sure you know your rights. People have been talking about making sure that you know your rights. And that is very, very important. Know your rights when you're in school. I knew my rights very early on, and a lot of people didn't necessarily like that. They didn't necessarily like that because it was a little bit of pushback from this standard, typical disability way, disability mold, as I call it. But knowing that really helped me pave the way for myself and to make sure that I got the right supports and services that I needed, but also led the way for other people behind me. And know that in whatever you do, in whatever source of advocacy that you do, you are paving the way for the people behind you. We talked about how tiring it gets, and yes, it does get very, very tiring. And there are nights that, you know, we're just frustrated and we're like, why does everything have to be so difficult? But when you know that you can make life better for another person, I don't think there's anything better than that. I will talk about too, I kind of jumped around a little bit, but going back to my medical life from a young age and telling my mom that I was going to be the one that made my medical decisions for me. One of the reasons, or one of the things that I chose not to do was not wear AFOs, which I'm sure some of y'all are shocked now. I'm sure some of y'all might even want to turn off the computer, but don't do that because you need to hear this. One of the things that I chose not to do was wear my AFOs. And people are like, why? Why? You obviously have this condition, you need to wear AFOs. And that's the functional model of disability, you know, what we do. This is how we're taught in the textbook. The reason that I didn't wear them was because they hurt when I put them on. And when pain interferes with quality of life and confidence is taken away, they really are no help at all. And that might not be the case for every single person. I'm not telling every person to not wear AFOs, but in my case, that was true for me. My mom noticed that my confidence went down when I had them on, that I just wasn't me, that I was just outgoing, bubbly person when I had them off, and when I put them on, they didn't work for me. And still to this day, people disagree with me about not wearing them. They're like, oh, but you need to wear them. And my counterpart to that is functionality over what we're taught to do. You know, if they're not functional for me, then why am I going to wear them? And if I'm going to have to deal with this disability for the rest of my life, or if I'm going to be disabled for the rest of my life, saying having to deal with it is a very negative term. So if I'm going to be disabled for the rest of my life, I need to learn what works functionally for me and do things that way, because that's ultimately what I do. A lot of times what we're taught in the medical community is how to live in a hospital standard. You know, we're told that we do things these certain ways, we do these certain therapies for this amount of time, and then we get here, and then we move on, and then blah, blah, blah. And with that, That's not how we actually live out in the community. We all have different lives. We all have different things that we do. And truthfully, we make our community by how we reach out in the community and what we do, whether we spend time with other people or whether we make a difference in that way. So that was a big thing for me in the disability community, was not wearing my AFOs and respectfully disagreeing with doctors or therapists or people on my healthcare team, realizing that I am the reason you have a team. I'm the reason you have a team. And I'm just as big of a part of the team as anybody else, and I deserve to be respected and valued just as much as my doctors and other people on my team as well. So realizing that you have that point in your life, and you have that ability in your life as well. You are such an amazing, intricate part of your team, and just know that you have the right to say no. You have the right to say no, and people might not agree with that. You might get a lot of pushback a lot of the time, but you have the ability to disagree with somebody respectfully, of course. I never want to completely shut down or dismiss people's opinions, but I think we need to have a two-way street of open conversation and some compromise as well. Maybe I might not wear AFOs all the time, but I might do some of your other treatments and vice versa. I think anytime you have a disability, or anytime in general, not even disability, anytime you're given a certain circumstance in life, people are going to tell you that you can't, that you won't, that you're never going to be able to do this. They're going to try to fit you in a box and say that just because you have this certain condition, this is how you're going to act, or just because you were given this certain life circumstance, this is what you now have to be because of this. And it's up to you to defy them. It's up to you to say, no, if that's not who I want to be, then that's not who I'm going to be. You can make the life that you want. You absolutely can make the life that you want. And some people are probably sitting here saying, well, no, I can't because my disability doesn't allow me to, or I'm not physically able to do that. And, realizing with that, yes, it's great to acknowledge that. However, just because your life doesn't turn out the exact way that you think that it should in your head doesn't mean that it's not a great life. It doesn't mean that you're not able to do something impactful or even do it in a different way. Life is an amazing gift that's been given to each of us. And it's something that should never, ever, ever be wasted. It might not turn out again like the way that we think that it should, but it's still such an amazing gift. And again, realizing the ability that you have to make a difference on your community and things is absolutely, absolutely a key part in it. Realizing that life shouldn't be lived just for yourself. And if you can have somebody find hope in your story or just share your experience with them, it's worth it. It's worth it, in my opinion, at least. And then also going off of what our last presenter had presented on through the lifespan, I just transitioned out of pediatrics for most of my care. As I said, I'm 23. And so if you look at pediatrics from 0 to 21, 22, I've really only been an adult with a disability or in the adult care facility for about a year. And it's sad, part of it, not all of it. Some of it's sad, but not all of it. I'm realizing that often people don't know how to treat my disability. Adult doctors don't know how to treat my disability because their background is in geriatrics. It's not in pediatrics. So I'm finding that I get treated like a stroke survivor, that people just again don't have the knowledge and the understanding of what CP is. So be aware of that as you get older. This is why I said know your disability. Know your disability and know how it affects you. That way when people say, this is the type of treatment we're going to do, you can say, okay, this doesn't work, or maybe we could try this instead. You have to be your own advocate. You have to be, so there are times where you might have to be your own doctor or your own therapist. And just make sure that you're able to do that. And knowing yourself and knowing how your disability affects you is huge. I'll share a quick story. I was working with a therapist one time, and the treatment again was really just like it would be for a stroke survivor. I won't go into detail as to what it was, but when I was talking to another therapist about it, she said, "Yeah, that's because this person was treating you like you had a stroke rather than cerebral palsy." And so we have a lot of work to do in the disability community as well as in the medical fields. All of us do, really. Those who are providers, we realize that kids with disabilities grow up to be adults with disabilities, as the presenters before have said. And then also with that, with a lot of work that we have to do, make sure you get involved. Make sure you get involved at a young age. And I'm not talking parents necessarily. Parents, great. We love you. I'm thankful for you. Everything. Y'all are awesome. You're amazing. But your kids are awesome and amazing too. And your kids are awesome and amazing and are the reason why you're doing this and should be involved 100% to their capacity, to their ability, and to their level of wanting as well. Some kids might not want to be involved at all, but the saying "nothing about us without us," that's very, very true. Ways that you can do that: get involved in local boards, state boards, get involved in local community groups, go out into the world. Just go out into the world. Go to the grocery store. Okay, you don't really see that many adults with disabilities out, honestly. And there's multiple reasons. There's multiple reasons for that. And kids too, you might not often see kids with disabilities out. And I realize that it's a lot. It's a lot to lug the wheelchair. It's a lot to lug the walker. It's a lot to deal with the stairs. It's a lot to do all that. But make yourself known. Realize that we're not going anywhere. We're not going anywhere. And the only way that we can create change is if we're willing to do it ourselves. You know, as I mentioned beforehand, some people just want to stay within the disability community, you know, because it's safe there. And I'm a little off put by that sometimes, because I'm like, if we're not willing to make the change, if we're not the ones who are willing to do that, then who's going to do it? Who else is going to do it? You know, because again, we are the only ones that know what it's like to be disabled. And, you know, another little interesting tidbit there, back to the doctors and the parents and everything, you know, they know what it's like to be disabled. I mean, I'm sorry, they don't know what it's like to be disabled. The equivalent that I like to use is doctors and parents and whatnot know how to be disabled to the equivalent of I know what it's like to be able-bodied. Okay, I have a pretty good understanding of what it's like. I think I know. Like, I'm pretty sure I have a pretty clear understanding of what it's like to be able-bodied. However, I will never fully know what it's like to be able-bodied because I'm not. And that's not something I will ever be. So being able to bring that perspective and value that and just know that is something that's really, really very, very important. And as I've said so many times, I don't know why it's been put on my heart to say this so many times, but just know your story, know your value. Don't be ashamed of who you are. And even if you are, work towards that. Work towards that. Work towards growing. Work towards being. Because people need you. People need to see you. And sometimes you might not. I'm sorry, I have a dog here who is trying to get in the presentation as well. But some people, you know, you may feel like you're not enough for some people. You may feel like you're different than other people. But know that just because you don't feel like you're enough for somebody doesn't mean that that's true. You know, you might not be everything to everyone, but you will definitely be something to someone. So embrace your life, love your life, acknowledge the hard times, but know that good will always come out of it if you allow it to happen. Your story is amazing. Your story is great. And I'm super thankful for everyone who embraces that. And I'm super thankful for everyone who is here today. Thank you for sharing your stories, you guys.
Wow. Okay, Alexis, that was beautiful. I hope that all the other presenters will turn their cameras off and turn their mics off. we can get to the questions. That was such a wonderful story. I'm so grateful that we got to hear it, and I can't wait. I've got some questions queued up. So if the others are willing to turn their cameras on so that we can get to the question and answer. Hello, Jason, and hello, Brenda, and there he is. Hi, Jan Willem. Everybody, it was beautiful presentations, and it was really neat to see how everybody flowed together so well, and then to hear Alexis finish it out and tie everything together was really well done. So let me get right to it with the questions. I'm going to start with Jason first. We had a question. What do you think, at least for you, what have you seen you need the most advocacy for? What's been the most frequent thing that families typically need to advocate for, at either a personal level or more general?
So I think that my experience probably shapes my answer a little bit. I think that, so I work a lot with equipment, and so getting insurance to pay for different types of equipment is a problem that I run into a lot, and I think really varies state by state. And even, you know, it's interesting to discuss with medical directors in the insurance companies who really don't argue that it's not necessary or medically necessary, but it, like, for example, doesn't fit the definition that they're working with. And so that's really a policy level issue. So I get that's where my experience lies. The other thing I would say is that I agree with Jan Willem that you know, preparing the adult medical providers to and to Alexis' point, to be able to be ready to take care of young adults with childhood onset disabilities, I think is a huge need. I think we've seen some specialties that have done that pretty well, or are a little bit ahead of time. I think it's something that I'm still working with my department to come up with a plan. We've made some areas of improvement. We have a specialized adult spina bifida program, which I think is great. I'm advocating within my own department for the same to be true of cerebral palsy, but it hasn't quite materialized yet. I think that's a real challenge. Even thinking about how do you set up the training program to support that? Because a lot of times folks really need the training in pediatrics to balance the adult training. And how do you fit that into a training program? I mean, other than, you know, we can, at any rate, I'll stop. Hopefully that was helpful.
Well, that was more advocacy on top of advocacy, right? You advocate for the equipment, and then you've got to advocate for the transition program. And one of the families commented while you were talking about that equipment advocacy really is one of the first kinds of advocacy that families find themselves doing. Let me see. I had Lynn. I had a question, or you had a question for Jan Willem about transition and resources. And I'm hoping that you'll unmute yourself to ask the question, or I can read it.
Sure, I can do that. Can you hear me?
Yes.
Yep.
Okay. So yeah, regarding transition to adult healthcare, I'm wondering, so I work for Ohio Family to Family, and as an F2F, we host workshops for families on transition to adult healthcare. So I've shared a lot of resources such as gottransition.org. They have a lot of checklists and readiness quizzes and things like that. You know, how ready is your child to advocate for him or herself? My question is, for those of us who become guardians of our adult children, because their disability is at a level when they will always need us to continue with intensive advocacy on their behalf. how are there any resources out there that help us to know how we need to adapt our input for those young adults? We still need to shift our focus from the parent role because we're moving from parent to guardian, and those are different roles. But gottransition.org doesn't address this one, and so I wondered if maybe you had any advice as to where to look for some sort of guidance.
Well, thank you, Lynn. Excellent point. I think, first of all, I want to sort of commend you on that family-to-family support, because I do think that as much as we try to do out as professionals to help and support and families and help prepare them for adulthood, there are so many things we do not know, and advocacy comes in many ways, and support comes in many ways. So the more families are connected is, in my experience, a very good thing, and we need more of that. So keep going, and I hope it will spread also in other communities. Because the worst thing is that families feel often very alone, right, in this process. I guess to answer your question, I do not know of a resource that is geared to your situation, right, as a guardian, and that change of role. I think conceptually, there's a model that is called the shared management model, which I really like because it sort of helps to understand that shift, and it's a dynamic thing too, right? So that from maybe more professional directed to parent directed to the young adults taking charge of their own health and the management of it to the extent, of course, possible. I think the challenge is, and it comes down to a chapter actually that I co-wrote on ethical aspects of transition to adulthood is really, we talked about autonomy and relational or contextual autonomy, what I mean by that is that every time in a certain situation, you have to assess together as a healthcare professional, as a parent, and a young adult, what the sort of the dynamic is at that time, and also what the topic is, right, that needs to be decided on. And to me, the principle should be always that the individual who it is about should have a say as much as possible. So you need to explore that in that situation. I think for a parent, I can only imagine how hard it is, because that step is often overlooked, is not taken. So you need to take the time first to assess actually somebody's capability or capacity to take charge, to be part of that conversation. So to me, the most important thing is, and advice is that to establish, as a parent, to establish those relationships with a few healthcare providers you trust and you can work with, so that that relationship has been established, and then you can work together. I don't know of any specific resources or tools, but I certainly will look into that.
Well, perhaps I can make a suggestion. You know, sometimes I run into that situation with young people and families, and if you're kind of on the cusp of whether you need guardianship, which is kind of, my understanding is kind of an all or none, as opposed to a power of attorney, which provides you both some resources, and you can customize the power of attorney more finely tuned. Of course, that's a legal determination that you probably want to have an attorney involved with, and that's not my area of expertise. But I do find something, if you have access to a neuropsychology practitioner that can really look someone who is familiar working with people with movement disorders, and if you can participate and communicate, you can kind of really get a good picture of strengths and weaknesses and capacity to make decisions. And that can sometimes help guide those decisions.
It's very helpful.
Good, thank you.
I have a question for Brenda from Teresa. Teresa, you want to unmute yourself, please?
Okay, can you hear me?
Yes.
Hi. Hi, Brenda. My question to you is, now that your son's become a teenager, I was just wondering if you found that his confidence has changed as far as being a strong voice for himself. You know, as they get into teenage years, they kind of hum on the fence a little bit. So I was just wondering if you found that with him now.
Yeah, that's a great question, because it's funny. My older son, who is neurotypical, his confidence has been waning as he hits the 15-year-old mark. But McLean, you know, I would say, and his situation may be unique, because as he gets older, he also has the ability to be more verbal. His vocabulary has been increasing, so his overall awareness of things is just greater. And so I think with those, you know, those things happening to him, it is allowing him to be a little bit more confident, because I feel like he thinks he's being understood a little bit more. He's able to communicate a little bit clearer. And so with that, I've noticed that his voice is getting a little stronger, both literally as well as figuratively. And so, you know, I mean, that might not be the case for all the kids, and you would expect sort of as those teenage years that maybe their confidence isn't as powerful as it used to be when they come running into the room with, you know, mismatched clothes and on top of the world. But I have found that as he has gotten older, he is becoming more confident, which is nice. So, you know, as his relationships deepen with his friends, as he realizes the allies around him, he's choosing. I think what's interesting, Teresa, is that he's choosing specific people as well to sort of be his confidants, and to be his people. And so, you know, we've sort of said to him, listen, if you can't tell us, you know, what it is, then, you know, make sure you tell so-and-so. And he's finding certain people in the school system that he likes to talk to more than others. And so he feels pretty confident when he's in those situations with people who know him well. You know, having said that, I think he'll always struggle with people who don't understand him well. In order, you know, I think he'll always struggle with confidence in that capacity, because he worries that they can understand what he's saying. But as his speech gets better, his confidence has definitely gotten better. And I hope that continues.
Good. Okay. Thanks.
And we have a question for Alexis from Angie. And Angie, I'm not sure if you'd like to unmute yourself. Give you a second if you'd like to.
Hello, good evening.
Hey.
So yeah, Alexis, it was just amazing to listen to your speech and just how confident you are. I have a young girl with cerebral palsy. She's 15, but she's keeps to herself. So just wondering if there's any activities that I can encourage her to participate in, so she can meet others and stay active.
So what area are you from? Are you in the US or are you in Canada?
We're in Canada, just outside of Toronto.
Okay, I'm in the US, so I could get back to you on some resources. But I will say, for those who are in the US, there's a program called I'm Determined, and that's for children with disabilities. And it's a summer program. I think it's like a week long, where kids with disabilities come, all types of disabilities, not just physical, learning everything, and they learn to build confidence in disability and outside, and just friendships. I completely agree and understand the keeping to yourself part. I'm not shy, but I'm one of those introverted extrovert people. Like, I really, really, really enjoy my time to myself. My first thought was that I'm determined, and then I was like, well, can she write? And, you know, maybe if she could write or make a video or do something to express herself in that way, at least she's getting it out. And then at some point, maybe if she wants to share those videos with other people or those writings and whatnot, that could be a way to connect other people. Make sure you look both in the disability community for things to do and in those without, because that's the way the world is. Like, it's not all going to be just one community or the other. And then if you happen to go to a place that's not for people with disabilities, don't be afraid of that. Don't be ashamed of that. and this is just my personal advice, some people might feel differently, but I don't tell them I'm disabled until I know I'm in. Because if I give them a way out, or if I tell them that I'm disabled, then that's a way out for them to be like, oh, we're not really sure. I'll tell a quick story of a friend. She signed her son up with severe CP for a theater camp. She paid her $200 down, got him in. It was like a week before the camp. She was like, oh, by the way, he needs wheelchair access, large print, and somebody to help feed him at lunchtime. And they were like, wait, what? And she was like, I've already given you my money, make it work. And that's the way you got to be. Sometimes people, you know, they don't want to put that much faith in it or that much trust in it, but that's the way you got to be. So that's just my little bit of advice for that. I hope things work out very well for her.
That was a beautiful answer. Willem, did you want to follow up?
Well, if I may add to that, and Alexis said it very, very well. That's also what we heard in the interviews that we did, and really that young people negotiate their identity. So it's not one or the other. It really depends on when do you introduce yourself as a person with a disability or with cerebral palsy, and on the other hand, it doesn't define you, right? As you beautifully said. So that might be another resource that you may be interested in reading.
Fascinating. Yeah, I find that even with us as parents, I do that sometimes too, and I won't say a word that my son has a disability until the very last minute, and then go in, and it's worked out pretty well. And I think for him too, it's he doesn't want to always be identified by his disability. So Lynn has another question. You want to unmute?
Hey Lynn, before you ask your question, I wanted to say supported decision making. Again, I don't know if you're in the U.S. or Canada, but here supported decision making is kind of a step not above, but a step in between the guardianship factor, and it's not something that's usually talked about here. It's one of those things that you have to know, because it's kind of really more important who you know over what you know type thing. And so if you can Google supported decision making, that's another aspect in it, and it applies both sort of the power of attorney type and then not so much guardianship, but it just gives you a different an alternative to full-on guardianship.
Is that based on the state that you're in? I'll Google it.
It could be. It could be. I'm from Virginia, so I'm familiar with Virginia's laws.
Okay.
Yeah, we have a lot of training and resources on supported decision making in Ohio for sure.
Okay, good.
All right, Lynn, you had another question for us?
So yeah, the issue was brought up a couple of times about adult practitioners oftentimes not really knowing how to treat childhood onset disability. Alexis mentioned, being talked to like she's a stroke survivor instead of a person with CP. And I know that clinics and practices all over are working on this, and they're trying to find a way to improve the situation. So I'm wondering, is there any place where like best practices data is being collected on this issue so that we can not have to reinvent the wheel and learn from one another? If there's a place that's really having success with this, is there somewhere that they are able to share that success and that we can all learn from it?
You want me to talk a little bit about it, Lynn? I think here is a role for the American Academy, to be honest. Of course, there might be good places, but it's really learning together and supporting each other, because nobody has the single right answer. One of the challenges is that adult healthcare, as you probably know, is highly fragmented and highly specialized. And that's great for many reasons, but for individuals with child onset disabilities and including cerebral palsy, it's probably not the best sort of type of healthcare that you need. So first, I always promote the primary care physician as a first resource. But then for specialized care, it's better that we build a network of specialists who have collectively that capacity. So I mentioned the special interest group for adults and aging, and I hope that will become the resource and the hub where professionals will share and support each other.
Well, guys, we are coming up on 2 hours now. We probably should end with that. And I'm so grateful for all of your beautiful presentations. I feel like it was incredibly valuable information for everybody, and I can't wait for us to share it on the Academy's website and with the Family Forum participants. And it's free for everybody. So, you know, it might be a long presentation. Everybody can put us on mute and pause us and come back to us later when they want. So I just wanted to thank you all so much for a wonderful presentation. And
Thank you for having us.
Thank you.
Thank you.